This is how you extubate. First, you want to receive an order and verify that order for extubation. While you're doing that, if you're not familiar with the patient, you also want to do a chart review and make sure there aren't any indications for intubation or there developed any indications for intubation. You also want to inform the RN and the nursing staff that you're going to be doing this so they're on the same page. You also want to make sure that before you extubate, you have all the necessary staff and equipment available or nearby to you in case something goes wrong and you have to do an emergency re-intubation. So after you've verified the order, you want to gather all your equipment. The equipment that you'll need is a syringe, scissors, an oxygen delivery device, and a suction catheter. So once you've gathered all your equipment, you're going to want to wash your hands and put on gloves. Next, you're going to inform the patient, introducing yourself by name and department, and also explaining the procedure, what you're about to do. You're also going to want to put the patient in a semi or high Fowler's position. For this, you're going to want to probably do like just a basic baseline assessment, so check their heart rate, their respiratory rate, SpO2, etc. You're also going to want to go ahead and assemble your supplemental oxygen delivery device and have that really close to you on hand and ready to go for after you extubate. After you've done all of that, what you're going to want to do is suction them, so you need to hyperoxygenate them. You check for indications for tracheal suctioning, but they may not need it. But what you are going to need to do is suction above the glottis, like right above that cuff. Make sure that you can get all of that nasty stuff that's sitting up there out of the patient before you extubate. Once you're done with the catheter, you can throw that away, and you're going to move on to preparing your yanker. And you're going to want to have this done so you can just have it sitting nearby for right after you extubate. So then what I'm going to do is I'm going to deflate the cuff and check for airflow around that cuff to make sure that we can still proceed with the extubation. You may need to occlude this tube here to really check for that, but if there is airflow and we can proceed, then I'm going to reinflate the cuff. I am then going to move on to cutting the tape off, and what you're going to want while you're doing this is either an assistant holding this to secure the airway or just make sure that you're doing it yourself. For this, I'm going to pretend an assistant's doing it. Carefully remove the tape. So after that tape's gone, you have your assistant securing the airway. You are then going to ask your patient to take a deep breath. You're going to deflate the cuff, and then you're going to ask your patient to cough. And as they're coughing, you're going to pull the ET tube out with the curve like nature. And immediately you're going to put on the oxygen delivery device for your patient. And after this, you're going to encourage the patient to cough a lot to make sure that they can get all of that expectorant out. After you put on the device, your patient's coughing, you're going to need to assess them. Make sure that they don't have like stridor, laryngospasm, edema, like the whole list. So you're going to do that by auscultating them, and you need to check all their vital signs, so heart rate, respiratory rate, blood pressure, SpO2, respiratory pattern, general appearance. If you've made those assessments and everything appears to be fine, then you need to go find the RN, and you need to tell them about like the time of the procedure, how the patient handled it, tolerated it. You also need to chart. Documentation is always important. And finally, you need to assess your patient for the need for bronchial hygiene therapy or lung expansion therapy.